Hello, my name is Bryden Blacklaws. I'm one of the emergency doctors here in Prince George, BC, and I'm also the sim lead at the University of Northern BC. Welcome to our sim lab. We have a state-of-the-art, fancy sim lab here, and thank you very much for signing up to be a preceptor. I really enjoy doing the sim teaching, and I hope you enjoy it too. Thanks for taking the time to watch this quick video. Basically, I want to introduce you to the sim lab and give you a few little pointers on how to teach sim. I'm no expert by any stretch, whether you're an experienced instructor or brand new. I think there's lots of opportunity for us all to improve, but I wanted to give you just a little introduction to the sim lab, the tools we have, as well as how we do a pre-brief, how we run a sim, and how we do a debrief. So let's go. All right, welcome to our main sim bay. We have 2 sim bays at Sim Center, as well as multiple task trainers and equipment that we can take to the floor and to classrooms. When you arrive, feel free to get in touch with Michael and Dean from the sim lab. He can set up a tour. When the learners arrive as well, he's happy, or any of the sim techs are happy, to give the learners a tour of the lab. Especially our new learners, we like to show them where all the equipment is and things like that. And while the learners are getting a tour of the sim lab and a little intro to SimMan 3G, I like to have a quick review of the case so I'm sort of up on it. I will show you now where all our cases are kept. Welcome to the control room. This is the little room with the one-way mirror behind the sim lab. I like to call this the brains of the operation, and this is where, as a preceptor, we get to sit back, change vital signs, and make the learners really work for the case. All our cases are kept here in binders. One of the fun things about teaching sim is there's more cases than you'll ever want to see. For the Med 3 curriculum, we've put them all into binders. For example, the ambulatory binder has all the cases for the ambulatory block, so when you arrive, just have a quick look at the binder for your day and maybe refresh yourself on the case. After we've done an introduction to the sim lab for the learners and you've had a minute to review the case, the first area I'd like to spend a minute is on what we call the pre-brief. So whether people are experienced or brand new, I think it's definitely worth spending a minute on the pre-brief. The main things I like to touch on in the pre-brief are, first of all, the expectations of the learners. The main thing is that the sim lab is a safe place to learn. All of us healthcare professionals are working to improve and get better at what we do, and the expectation of the sim lab is not that you come in and masterfully treat every patient and get everything totally right. These cases are set up to be harder than where people are at and challenge people and try to learn from. So when we actually see these cases in real life, we can manage them better than we were before. So one of the main things I try to hammer home is that this is a safe place to learn. We're not going to leave the sim lab and say, oh, so-and-so didn't know how to do that or mismanaged that. No, that's not the point of this at all. This is a safe place for all of us to make mistakes and improve. The second thing I'd like to touch on is just the value of imagination. We spend a lot of money and time and resources on trying to make this sim as high fidelity and real as possible, but obviously it's not real. But I like to really remind the learners that the more we buy into this being real, the more real it becomes, and if we all sort of buy in, then the cases can become very high pressure and feel very real. The next thing I like to do is set the scene. So where are we? Are we at a level 1 trauma center in Halifax, Nova Scotia? Or are we in a community hospital in Vanderhoof, BC? So where are we? What's our backup? What's our resources? What do we have to work with? As well, who do you have with you? How many people are in your team? I like to assign roles. So, all right, group, let's assign roles. Maybe there's going to be a leader, a team lead, a staff physician, someone like that. Maybe a resident, a nurse or 2 nurses, maybe an RT. There's all sorts of possible roles that people can be. So let's set the scene, let's get the team ready, and then we're almost about to start the case. We're all ready to go. What I like to do is I like to get the group outside the door, and I like to start the case with something somewhat dramatic. So the case is ready, the learners are outside talking about what they're going to do and how they're going to approach the case, and I like to open the door and say something like, any doctor staff to the sim lab, or code blue sim lab, or I like to walk out and say, hi, it's Bryden Blacklaws, the paramedic, I've got a case here, or hi, it's Bryden, the nurse on Surgery South, we have a patient that's quite sick here in the Bay. Something like that, just to provide an introduction for the learners to come into a very real environment. Once the case is started, there's 2 basic ways that sim can run. The first is our sim techs are so fantastic, and a lot of these cases are designed to flow
quite naturally that you can sit back and let the case flow. The sim techs will input the vitals, input the heart rate, rhythms, put up photos of x-rays, ECGs, etc. So you can sit back and watch it flow and let the sim tech run it through. That's option one. And option two is you can take a much more active role, and I'm going to give you a few fun little tips on how to make it more creative. So the first one is with this microphone right here. So the two fun things we can do are we can speak for the patient. So we can press the microphone button and I can be the patient. So, oh, my chest pain is so bad, or oh, I can't breathe, or something like that, and the sound comes out the SimMan 3G, so it sounds like the patient's talking. The second thing I can do with the other mic is I can be this overarching voice, like a charge nurse or someone like that, saying, would you like some epinephrine, or would you like some IV fluids, or something like that. So that's a couple things you can do. Another really useful tool is to call timeout. So if you're back here watching the case go and like, ooh, that's really not going well, I like to call it timeout and walk into the room and say, timeout team, you're doing a great job, but do you think maybe we've missed the diagnosis, or do you think maybe that chest tube was in the wrong spot, or something like that. So we can use timeouts to just sort of stop the case and alter a bit of the learning right there, just to focus on a really high yield point. The other thing we can do is we can use timeouts to do procedures. So on SimMan 3G we can do a lot, but we can't do things like chest tubes. So sometimes, let's say there's a blunt force trauma case with a pneumothorax. Well, when it comes time to do the chest tube, I might say, hey, timeout team, let's step away from the SimMan and go to the task trainer, and we'll all practice putting in a chest tube, sort of so it flows with the case, but we can't obviously poke big holes in SimMan 3G for every chest tube. But that's an effective way to use timeout. The other things I like to do is to change the cases based on how the team is doing. So if it's a really junior team, that we're going to keep things simple, but if the team's doing really well and they're really nailing the management of the case, well, by all means make it harder. If it's a basic anaphylaxis case that they're nailing, well, let's make it anaphylactic shock. That wasn't our plan, but we still have 30 minutes left. So feel free to make the case easier and harder based on how the learners are doing. Another fun thing to consider if the team's doing really well is to really throw them a curveball, and we have some dress-ups and wigs, and you can put coats on and hats, and sometimes I like to go in there and pretend to be somebody, maybe a very distraught family member, or a boss, or a CBC reporter, or an RCMP officer, or one of my favorites is pretending to be a drug dealer for the patient looking for money. There's all sorts of fun ways to add really challenging social aspects to these sim cases, and as we know, that's a very challenging part of real-life medicine, so I think it's a fun thing to add to the sim case too if you want. I like to leave about 15 minutes at the end of the case for the debrief. So if you're coming up to about 15 minutes left, or the case has really just run its course, feel free to end it. There's lots of ways to end the case. A lot of the cases have endings built into them. Patients can live and get better, or patients can pass away after an extended code. If the learners are doing really well, sometimes I like to force them to do a transfer to a high level of care, ICU for example. I'll pretend to be the ICU doctor in another town on the phone and force them to do a real complete review of systems and review of the case, like a full-on ICU transfer. So that's a fun way to get a bit more out of the end of the case. And then once the case is done, let's go do a debrief. Alright, well you've run the case, it's gone great, and now it's time for the debrief. So we really like to bring the learners into a separate room if possible to give the staff a chance to clean up the sim lab and prep for the next case. So when we go down to the debrief room, everyone sits down. It's our job to facilitate the debrief and really maximize the learning from the sim case. So there's lots written about debrief, there's lots of debrief tools. Basically, as a preceptor, we have 4 jobs in the debrief. One is to let the learners summarize their experience of the sim. Second, we want them to say, what went well? What did we really do well? The third is, what are our areas for improvement? What did we really not do well and what could we do better next time? And the fourth thing is to identify what the learning issues are for when we go home. So as a preceptor, there's a couple of questions I like to ask. The first one I say is, all right, team lead, how do you think that went? A nice open-ended question usually gives lots of feedback. The second thing I like to say is, hey group, what do you think went well and not so well? And I often go person by person, and people often have lots of good things to say. The third thing is I like to say, okay, we had a case on, let's say, croup. Well, I really want to make sure that everyone understands the correct management of croup. These are the things that went well and not so well, but this is really how it's done. And I do think it's important to hammer that home. As part of the debrief, when learners start reflecting on the case, I find something that often happens is people are very self-critical. They're way harder on themselves often than they should be, whether they're experienced physicians down on themselves for not managing something correctly, or brand new learners expecting themselves to be, critical care doctors in Med 3. I really like to say, you know what, the point of this is not to manage this case flawlessly. The point is to learn. So first of all, what did we do really well? What are the positives here? There's usually lots. Like, the communication was good, really good closed-loop communication. You really identified that diagnosis or did that treatment plan really well. I really liked how you summarized the case or set up the transfer or called for help. So once I say what was done really well, in my opinion, I like to go to the parts that really need improvement. So whether it's communication or clinical decision-making or ordering tests or interpreting tests, I like to identify a few areas that really could improve, and then we all usually agree, and I get people to write down 3 solid learning issues about the topic for people to take home. All right, well, thank you very much for taking the time to watch this quick video, and thank you very much for teaching sim. The students love it, and I just hope you enjoyed it as much as we do. So there's a document that goes along with this video, just sort of outlining a bit more about each of the steps to teaching sim, and whether you're an experienced teacher or brand new, there's so much to learn in sim, and we've included a long list of other resources and courses, observation tools, and checklists that you can check out if you want. So again, thank you very much for taking the time to watch this video and teaching sim. We sure all appreciate it, and the students really appreciate it. If you have any questions at all, feel free to get a hold of me, Friday Black Laws, Bridge George BC. Thank you.